The Efficacy of Music Therapy in Addictions Counseling by Gerald Belnavis for Aspen University. Substance abuse is a serious problem in the United States, and as such, a variety of treatment interventions have been crafted in an attempt to improve outcomes in counseling programs. Music therapy has been widely used in mental health treatment, but to only a limited extent in substance abuse counseling. The purpose of this paper is to review current music therapy research, to examine the clinical efficacy of music therapy in addictions counseling, and to recommend an expansion of its use if warranted by the evidence. The current literature reviewed is generally supportive of music therapy interventions in mental health counseling and in substance abuse counseling. Soley et al. In a 2013 study concluded that music therapy interventions can contribute to the quality of mental health care by creating a forum for stimulation and development of strengths and resources that may facilitate the growth of positive identity and provide hope for persons suffering from mental illnesses. Lesuk, in a 2010 study, concluded that music-based cognitive therapy in conjunction with counseling can improve attention and executive function and can contribute towards the improvement of behavioral problem solving that is essential in the recovery from drug addiction. Albornoz, in his 2011 randomized trial, investigated the effects of group improvisational music therapy on depression in adults and adolescents with substance abuse and found that improvisational music therapy had a clinically significant effect. Despite the promising evidence concerning the quality of music therapy in mental health counseling, and addictions counseling in particular, there is a central theme throughout much of the resources that I have examined that advocate for further research on the topic. Silverman, in a 2003 study, recommended further quantitative research as strongly warranted to refine unique aspects of music therapy interventions. In terms of procedures, this researcher used four web search terms to locate the relevant literature concerning the topic of the study. The search term music therapy and mental health counseling was used to locate literature that covered the use of music therapy as a general intervention for mental health and not specifically for patients with substance abuse. The rationale of this strategy was to provide evidence of music therapy as an accepted form of mental health intervention. Subsequently, the search terms music therapy and addictions counseling, music therapy and substance abuse, and music therapy and chemical dependence were used to find the literature that focused on specific examples of music therapy interventions in addictions counseling. Also, the literature search yielded hundreds of articles that were screened by an inclusion and exclusion criteria based on the stipulation that references for the paper should be no more than 6 years old and by other criteria set by the researcher. The inclusion criteria were as follows: articles no more than 6 years old, references that included music therapy in mental health, and material examining music therapy in substance abuse counseling. The articles were screened against the inclusion and exclusion criteria, and 22 references that were considered by this researcher to be the most relevant to the topic were chosen to be included in the paper. Results of the investigation. Although less than 4% of the members of the American Music Therapy Association reportedly work in drug alcohol treatment settings, close to 15% report working with clients who have had addictions. Based on the findings from the studies reviewed in this paper, music therapy has been shown to be an effective intervention in mental health counseling. The data supports the efficacy of music therapy in mental health counseling. Music therapy is effective for mental health care clients with low motivation and other therapies that was established by Gold and Mosler in 2013. Music-based cognitive therapy, such as music attention control training, has been shown to help clients to strengthen the cognitive skills necessary to deal with situational triggers that was established by Soley in a 2011. Music therapy may be most useful to clients who do not respond to other interventions, such as persons who are unable to use verbal discourse therapeutically as established by Gold and Mosler, 2013. Music therapy has also been shown to reduce levels of self-reported negative affect among inpatient men and women in an integrated dual diagnosis treatment program, as found in a study by Gardstrom-Bartkowski et al. In 2013. Music therapy has also been shown to positively influence change readiness in substance abuse patients in Detox Unit, Silverman 2011. Group improvisational music therapy can work to reduce depressive symptoms. That was found by Albornoz 2011. And music therapy is also effective as an intervention for reducing depression in women in a substance abuse treatment center, as established by Gardstrom Carlini et al. In 2013. While current research overwhelmingly supports the efficacy of music therapy, the consensus is for the need for further studies. The evidence suggests that the need for increased use of music therapy interventions within substance abuse treatment centers. It is hoped that through further research, music therapy interventions will be increasingly used as an additive treatment in substance abuse treatment.